Yeah, so thank you, Bida. I also would like to join by saying good afternoon to everybody who has joined this call from wherever you have joined us, whether in South Sudan or elsewhere. Um, Today, as I mentioned yesterday, that today we might have a little bit a longer presentation because of the interest people showed in today's topic. And I want to invite all of you to really participate and share your experiences and comments and ask questions. And I'll do my best to answer them as well as I know. Otherwise, I'd like to begin by taking us back to yesterday. I don't remember the name of the participant, but somebody had asked a difference between subjective well-being and personal well-being. Excuse me. And I think I did try to explain that. To me, it was more or less the same thing, just different English words. And so I had to try to look it up. And so subjective well-being, one person, one psychologist defined it as people's cognitive and affective evaluations of their lives. So like I said yesterday, you are the master of your own life, your body. If you tell me this is what you feel, that is definitely subjective and it is personal to you. So without really taking much time, I think I just wanted to highlight this for somebody, the person who asked, to really be able to know that they are more or less the same thing. However, they did not fall, whether personal well-being or subjective well-being is not necessarily a separate form of well-being, considering the different forms of well-being that we looked at yesterday. You would think of this as the combination of all those forms of well-being contributing to your overall personal or subjective well-being. I think let me leave it at that. So we can go to today's presentation. Again, I see people online, including others who are of medical background. I will be very glad for us to share this discussion together. And so to also hear from you will be a very nice thing during the presentation. Right, so I think according to the schedule Bida shared, we were supposed to do a recap. Bida, am I right?
Yeah.
Would any member in this call who attended yesterday, would they want to say a few things about what we covered yesterday before we go to today's session? Anybody? If you would want to remind us. Yes, Daniel, what do you remember from yesterday's discussions? Go ahead.
Well, thank you so much, Doctor. Though my network was not that well, I was able to pick some of the things we talked about yesterday. We talked about personal well-being, and we said personal well-being is one's ability maybe to cope his own, life. It's not that you're healthy. It doesn't mean you are healthy, but you are contented, you are okay, you're satisfied with your status, and you know your status. So that is what is called personal well-being. And personal well-being encompasses a lot of things, like emotional well-being. You have to be emotionally well, and also physically, like we talked of also doing exercises sometimes, like maybe 1 hour, 3 times a week, or we talk about doing it like 30 minutes every day if you can afford, or maybe some 5 minutes if you're working, of stretching and all that. So those are also financial well-being. We talked about it because it can influence our mental health. Let me put it that way, because if you are financially illiterate, you will use your resources in the wrong way, and then you will be mentally affected. So those are the things we talked about. A lot of things I remember, but let me give the time to my colleagues also to be able to elaborate what they understood. Thank you.
Thank you, Daniel. Excellent. Anybody wants to add a few more things? One more person, and then we go to our second session today. Our session of today. Anybody wants to add? Well, if there's nobody else, that's fine. For the interest of time, I will not spend much time on the recap, but Daniel did cover important parts, things that we talked about yesterday. And the latter part of the presentation yesterday, if you remember, was to do with the what checkups do you need to do for the different age groups, for the different sexes, so that they are, you know, they are done for you, and somebody can guide you and tell you that this, maybe you have this risk, or you have possibility of developing such disease and all this. And I said that wellness packages such as these tests for the different age groups are very helpful, because they help you and the doctor to be able to pick up disease at an early stage, hopefully, so that it can be cured. Yeah, today I fixed my webcam. I think the problem was the computer I used yesterday, the webcam was not all right. So I'm also happy to see some of you online. Great. So I think let's leave it at that. When the slides are shared, you will definitely go through all the other things we talked about yesterday, and it should be very easy for you to refresh yourselves with the knowledge. So let's go to today's presentation or session. So today we are talking about trauma, self-harm, and then we do stress management. Again, my name has not changed over there, as you see in the slide, and these slides are prepared particularly for you who are online today, and you are brought here by EFSS. So I would say these are slides that will belong to them. Again, I want to begin by a disclaimer that whatever we will discuss here should really not be taken as enough medical knowledge to make your own personal diagnosis or prescriptions. I will not want to hear that somebody attended this and they decided to go to a pharmacy with a name of a drug. I don't think I actually mentioned any drugs in this presentation, but please don't do that. Whenever you're not feeling so well, the best person to look at or to see is a trained medical person. So that disclaimer. Again, like we did yesterday, let's start with what you know. Those of you who are in this call, what do you know about today's topic? Let's begin with the first question. You may chat, you may text in the chat box if you want. But if you want to put up your hand also, maybe 3, 4, 5 people we can allow to say what they think. And we will go one question after the other. For example, in the first question, excuse me, what is stress according to you? And what is psychological trauma? So I had to specify psychological because there are many other forms of trauma, including physical trauma, such as getting cut on any part of your body and things like that. All that is trauma. But today we are talking mostly about psychological trauma. So what do you understand by stress and or psychological trauma? I see somebody had put up their hand, but it has gone down. Any? Yes, Angel. Go ahead.
Yeah, thank you. Trying to define a trauma. Trauma
Yes.
is an emotional response to events like accident and rape. Yeah, so that is how I define it. Thank you.
Thank you, Angel. What about stress? Any idea, Angel? What do you think is stress? Or are they the same? Right. I think, Daniel, you have your hand up. Go ahead. Daniel, we are answering the first question. What is stress? What is psychological trauma?
Well, Angel defined it emotional, this one well, trauma well. Stress is also how we react, to situations like if we are in a situation, then okay, let's say the situation is bad and our reaction really is also bad emotionally. It means we are stressed. Then we need to find out how to deal with that psychological stress. Psychological stress and trauma are almost the same, but stress can be a short term, and trauma can be, a long term, or can affect your emotions. That's what I understand. That's my own understanding. Thank you.
Great, excellent, thank you. I have seen a number of hands up, but I will recommend that you text your answers in the chat box, because the first two people have really given us very concrete understanding of what stress and trauma is, especially differentiating between stress and trauma. Trauma being that long-term held kind of, painful feeling or harmful feeling somebody may have gone through, a distressing thing. So that actually becomes trauma. All right, so what are some causes of mental or psychological trauma or stress that you know? Any feedback? Can be in the chat box or by raising your hand. Anybody? Anybody has their hand up? Go ahead.
Yes.
Yes, Christopher.
Yeah.
What are some causes of psychological trauma and stress that you know?
For stress, sometimes some causes might be like money problem, or having serious illnesses, problem at work, or getting laid off from work, or the death of loved one also can cause like a stress.
Correct.
For for trauma, these are events that might be happen in your presence, then you like experience it later, like when, like for our case for South Sudan, when you witness somebody being killed when you're near, those are some causes of the stress.
Great.
Of trauma. Sorry.
Thank you,
Yeah,
Christopher.
so I can
Thank you.
stop there.
Dusman, Florence, your hand is up. Dusman, can you hear me?
Yeah.
Yes, share with us.
I'm getting you, yes.
Go ahead.
Okay, the causes of trauma or the causes of stress might be rape, that is one, and domestic violence, and sometimes it can be caused by natural disasters, and sometimes witnessing an act of violence. So to my definition also of stress is the feeling of being overwhelmed. Yeah.
Okay. Great, thanks. Yeah, thank you. Lukadi, anything you want to share with us that has not been said? Joseph. Lukadi Joseph, are you there? Please, the rest of you mute, kindly mute. Lukadi Joseph, your hand is up. All right, so if your hand is up by mistake, maybe you can lower it. Let's look at the third question then. What do you think are manifestations of psychological trauma and stress that you may know? How do people who are stressed, who are traumatized, how do they manifest? What things do you see that might suggest to you that this person is stressed? Daniel, is that a new hand?
Yeah, it is a new one actually.
Go ahead.
Well, I have witnessed some manifestations of mental trauma and stress. You will see like some people are getting mad also from trauma. Sometimes they run mad. Sometimes you will see someone talking alone, walking alone on the road and is talking alone. So that is a manifestation that this person is stressed and is trying to find a solution, not knowing that he's on the road, he not knowing that he's alone. So you will see those kinds of things happening. You will also see someone like shaking his head, like if you are with someone, you're sitting with him and you have not said anything bad to that person, but it's just shaking the head, you will know that this person is stressed from somewhere. And as a good friend, you will have to find out his problem and then try to advise him on it. There are a lot of manifestations that I know, but let me leave the rest for my colleagues. Thank you.
Please. Thank you, Daniel, for being so generous. Moro, what do you want to add to what Daniel has already said?
Yes, thank you so much. Some of the manifestations of mental trauma and stress that I know are lack of concentration. Sometimes there are some people who are stressed and you find they don't really concentrate on some other things that they can easily, that other people can easily grasp, but for them they fail to. And sometimes also you find some people transfer anger that is from probably their childhood or from some other events that happened. They transfer into other people who are even very innocent. Like, for example, parents tend to bring their stress that they have had maybe with their loved ones or with their friends or even with other people. They tend to bring it and put it on the children. And sometimes even mothers who have undergone rape and other violence cases, instead of handling it the other way, but they tend to transfer that anger into their children.
Excellent.
Yeah, thank you so much.
Excellent. Lemery, you want to add one or two things? I also am aware of some very good responses in the chat box. I think I really appreciate all of those. Yes, Lemery, go ahead.
Yes, thank you. A quick one. Am I live?
Yes, go ahead.
Yeah, some of the manifestation of mental trauma and stress that I really know includes being moody. Mood is change of mood swings, like you find someone really not at all time happy, or at most those behaviors that are not considered normal happening to them. And we have hallucination. Hallucination here is those bad dreams. At night, we call them now nightmares. They're also common. Now, the last one I would add is being irritable. Irritable here is someone is irritated by anything in the environment. Thank you.
Thank you so much, Lemery. Please continue your comments going on in the chat box. In this discussion, there is particularly no wrong answer or a correct answer, but all things that you've shared with us so far are really true regarding what we have been discussing and the questions. Lastly, how would you manage? How would you help somebody with a mental trauma or psychological trauma or stress? How would you? Let me look at hands from people who have not spoken before. Will do. How would you?
Yes, one of the things someone could manage the stress is that you lean on your loved ones. It is very common that if you want to help from people, you ask for support. You could ask support from your friend, from family, because they are saying that a problem shared is a half solved. If you want to manage the stress, you can ask your friends, your loved one, or anybody to help you facing what you are facing. The second one is for you to face your feelings. Sometimes it is hard for some people to run away from what they are facing. But if you could turn around and face the problem, sometimes you can manage it. Thank you.
Thank you. Thank you, Will. Go, Christine, your hand is up. How would you help somebody with the psychological trauma or stress? Well, can you hear us? Go ahead if you want to share with us.
Yeah, I was wanting to explain like the last questions where you say, how could you manage mental trauma and stress?
Yes.
According to me, how one can manage mental drama or stress is like engaging yourself into something that you feel you're comfortable in, and like especially maybe social gatherings and visiting friends and colleagues. And then also, if you find that you're not able to talk to yourself of what you're going through, find a best friend that you can communicate to and can also advise you according to what you're going through. And one thing, if you also have a hobbies that you feel you always okay with a talent, engage yourself into your hobbies and it keeps you busy. That one can also drive you out from way of how you will manage your stress.
Great.
Because most of the results that causes stress and drama may be, you may have an achievement that you have in yourself, but at the end it fails. So it can give you that kind of stress. So to avoid that kind of stress, you should know your goals, work basing on your goals and basing on your effort. And that way will make you prevent the causes of stress and drama. Because if I look at someone who had already achieved and we were all in the same level and achieved all that you wanted ahead of me, and then I will start thinking about myself, what is the cause of all that is happening that I'm not able to reach? So if I start thinking about what is going on, and then it will cause me a lot of stress. So one should be comfortable in his own lifestyle and his goals and steps of achievement in life. That's the little points
Thank
I
you.
can share with
Thank
you
you,
guys.
Gugo.
Thank you.
I see in the chat box somebody is asking whether we are talking about personal management or clinical trials. We are really looking at within your society, where you work, where you stay, whom you interact with. If you are able to identify that Leju is stressed or he is traumatized, how would you help me? That is what we are trying to discuss. I've also seen a number of beautiful answers in the chat box. Please be checking them and also learn from what your colleagues are saying. One particular interesting one by Richard Mawa is saying, being less sensitive. Richard, would you like to shed some more light on that answer? How will being less sensitive help manage stress or trauma? Richard Mawa? Are you there? I think he has dropped. I don't see him in the call now. Right. Anyway, no problem. Those are all very, very beautiful answers. In the interest of time, we will continue with the presentation. You will definitely see most of these answers that you have put appearing in the slides. Many of them I may not have also captured, but I said yesterday that these sessions are only to open our minds and be able to look beyond the slides and understand things around us much better. So you should not expect everything to be really in these slides as you may want them to be. Thank you all so much for participating. Let's proceed with the presentation. So in this presentation, I'll give you a brief background to trauma and stressor-related disorders. Disorders is simply abnormal functioning. That is a disorder. Something that is not, that makes the body not function the normal way can be termed as a disorder. So there are many things, disorders that come as a result of trauma or stress. So we'll look at some of them, maybe not all. I have decided to take about 3 major ones that we will discuss here today. We'll look at generally signs and symptoms of trauma or stress, which are some of the things we have already discussed and you've shared with us. What could be some risk factors? You mentioned some of them. And then the different forms of trauma, stress-related disorders. But in particular interest for us today is self-harm or suicide, which we will also discuss. And then lastly, we will look at how do we really manage stress as a whole. So that's our lineup. So like some of you put it already in the discussion we have just had, psychological or sometimes called emotional trauma is damage or injury to the psyche. When you hear psyche, it's to do with the mind. Okay, so any injury or damage to your mind, to your reasoning, to your thinking, to your understanding of things. Okay, so that injury after that person has lived through an extremely frightening or distressing event and may result in challenges in functioning, So that person will not function well. If they used to, for example, go to work and, you know, spend all the 8 hours, they may likely not do that anymore. So their functional level decreases, or that person becomes unable to cope with the situation they have at hand now because of this injury that has affected their mind seriously, extremely, okay? It could also be any situation that leaves one feeling alone and completely overwhelmed, as somebody put it, okay? So that kind of situation can be traumatic, even if it doesn't have any physical harm on the outside of the body, but it can still be traumatic. It's important you should know that it's not the objective facts of the event alone that whatever happened, but actually the subjective emotional experience that somebody goes through, okay, is also to be considered in determining how traumatic an event is, okay? So if I have lost a loved one, okay, probably most of us have, right? So it's not just because I've lost a loved one, but now the emotional experience that I will be going through because of that loss also contributes and determines how much trauma I will experience because of that loss, okay? A potentially traumatic event is more prone to leave an individual with a longer lasting emotional and psychological trauma if, for example, if the individual was unprepared for the event. Let me give an example of a relationship, love relationship. For a few months, years, you've been so nice, so well, and so on. And then one day, one of the two in love wakes up and says, you know what? I guess we are done, right? Nobody was prepared for such shocking news. So if someone is unprepared and then the event happens, they are likely to have more emotional or psychological trauma. Also, if the event occurred out of the blue, you know, similar to the first point, out of the blue, you're just walking and then maybe, this is common with the accidents people get, whether you're walking or using any automobile, you know, out of the blue, you find yourself traumatized. The person felt powerless to prevent it, okay? You really foresaw that it might happen and you tried your best, but it didn't work. You are likely to get more traumatized. The event occurred repeatedly, and this example of rape, child abuse, and some of these things that happen in our societies, repeated happening of such events can make them more traumatic than if they ever happened once. The event involved extreme cruelty, okay? The event occurred during the childhood years. So these are examples of situations when traumatic events happen and they are likely to lead to somebody really experiencing trauma or stress-related problems in their lives. Examples of these events, we have shared many of them, I'm happy, but just to highlight, natural disasters, I'm happy somebody mentioned such. You know, if you follow the news, a lot of countries in Europe currently are experiencing very high temperatures and even outbreak of wildfires. Those can be really traumatic events over a few weeks or months from today. You hear people, you know, experiencing trauma because of such. Earthquakes, these ones happen a lot of times, tornadoes, hurricanes, and even COVID-19 that for now seems to be going down attention on it, but it's still with us, right? So natural disasters are examples of events that can cause trauma. Somebody mentioned rape, child abuse. Of course, suicide or death of a loved one or a friend can always result in trauma. Serious car accident, workplace accident, accident anywhere can really be a very good, a very big cause of trauma to the mind. And then acts of violence, armed robbery, very common, war, terrorism. It may be that you are the one directly involved in these things, like the war, you are in the front line, a soldier, or you are just, you know, experiencing collateral effect of these things happening. These are some examples of events and situations that often lead to psychological trauma. However, there are also others that not many people pay so much attention to, like breakup or divorce in a significant relationship, such as a marriage, for example. This can be very traumatic. Any significantly humiliating experience can also be traumatic over some time. Surgery, people who undergo surgeries, depending especially on the magnitude, if it is a big surgery, major surgery, or one that takes too long for the person to recover from, these things can, for some people, cause serious psychological trauma. Of course, I talked about physical injuries such as falls, injuries, cuts. Maybe you are a sports person and then you got injured, or anything really. As we know, we get injured anytime. Sudden unexpected death of a loved one. Sometimes some people tend to take it, yeah, we all die and this and that, but to someone in that family, it might be really a very big event that can really lead them to stress or trauma. Diagnosis of a life-threatening or disabling condition, being diagnosed with a cancer, for example, and being told that this cancer is now in a stage that cannot be helped. There are certain cancers that if they are diagnosed early and maybe a certain treatment is given, somebody actually gets cured. But if it is diagnosed very late, most cancers as they are, people just end up dying. And before the death actually comes, you realize sometimes the death comes faster because of psychological trauma as well. So these are some other examples of events that lead to trauma. Signs and symptoms, some of you already mentioned many, including the nightmares somebody mentioned, but they have been so far classified according to cognitive. Cognitive refers to the highest functioning of one's brain and mind, to say. So the highest functioning of your brain is referred to as cognition. What are these highest functions? Things to do with the speaking, things to do with the thinking, memory. Those are considered highest functions of the brain. And so these may include things that somebody is consciously aware of, or others that somebody may not be actually consciously aware of. So with the stress and trauma, somebody can have what we call intrusive thoughts of the event that may occur out of the blue. Okay, so the event has happened, but once in a while, you keep thinking about it, and that sharp memory comes in your mind, and they intrusive thoughts. They just come out of you're actually doing something else. Like I'm now trying to, I'm actually presenting to you, moderating this session. But then I remember some trauma or some stress I went through or event, and then all of a sudden I'm off my mind and I can't concentrate. So those are the intrusive thoughts that people can go through. Nightmares, mentioned by someone, visual images of the event. Think of an accident, terrible accident, fatal. You witness it. It can really be a big problem for some people because they can keep having images of what happened, and it can always cause them trauma. Loss of memory and concentration, somebody mentioned. People can become confused and disoriented. Today being Sunday, somebody might think it is a Friday and they can insist on it. You cannot easily convince them. They are just disoriented, they are confused, and it could be, because of a trauma they are going through. Mood swings, somebody mentioned that. And then in terms of behavior, people begin to avoid things that they usually liked to do, or places they liked to visit, for example, okay? Or sometimes they can avoid places that when they go to, they tend to get memories of what happened, the event, so they avoid. Like those of you who may have followed stories in Juba, not long ago, the traumatic event of 2 people being shot dead at a certain hangout spot. Somebody may be traumatized from that event and can avoid going to hangout spots again. So that is a behavioral sign that somebody is going through something in their mind. Social isolation and withdrawal are very quite straightforward. Somebody no longer associates with the people that they used to associate. Lack of interest in previously enjoyable activities. Somebody has been a football fan. They always looked up to the weekend to go and watch, but something terrible one day happened and they are no longer football fans again. That kind of behavioral thing. Physically, we can be able to see that somebody is stressed if they go through some of these things. Like you mentioned many others, and I said that these are just to highlight. Somebody is easily startled, they're doing one thing, and then all of a sudden, you can even visibly see that they have either gotten a very kind of shocking or surprising change of maybe body posture or attention to something. They are easily startled, right? tremendous fatigue and exhaustion, even when they have not done any physical activity, not even any exercising, but they are always fatigued. They always feel exhausted. The mind is not well, okay? They can also complain of aches, pains throughout the body, which may be vague, undefined, not easily defined. These are some physical signs that can tell us somebody may be going through something. Tachycardia here, for those who are not of medical background, this simply means heart rate higher than the normal range, okay? So people's hearts beat faster, even when they are resting, they are seated, but they always have high heart rates because they are traumatized. Their mind is, is always awake and a lot of danger around them, okay? Even that is the next point, extreme alertness, always looking out for warnings of potential danger, and their heart rate can go high. Insomnia is either lack of sleep or sleeping too little time, and then sleep goes away. Sometimes because of trauma, people can have sleep changes and even eating patterns. Somebody who used to sleep 6 to 8 hours only goes to bed, and within 2 hours they are up and completely no sleep until the next day, and they can actually do things. That may be a sign that things are not well. Of course, sexual dysfunction has a lot of mental contribution to its success. And if somebody is mentally not really well, they can easily develop sexual dysfunction, especially for the males. Then psychological signs, overwhelming fear, or they are ashamed of themselves. Some of them can have what is called obsessive and compulsive behaviors. They become obsessed with something that they may not have actually been interested in. They can become obsessed about such things, or they can become compelled to either saying some things or doing some other things that really may not be helpful, or they may not have been doing them, but they now become what? Compelled to such. So any such behaviors may be a signal that things are not well upstairs, I mean in the mind. Detachment from other people and emotions. So really, stress or trauma tends to present in two ways. Somebody can become overwhelmed, as one participant here said earlier, and when they are overwhelmed, they tend to show out that activity or behavior or sign or physical signs that are associated with that. But sometimes this trauma can actually depress someone, what we call emotional numbing. So they become numb. You know that this is somebody who is usually lively, talks with the people and laughs and smiles, but because they are going through something, they no longer do such, and they are just, so sad, so silent. These are psychological signs that somebody might be going through trauma. Depression and suicide, we will look at these two in the next slides coming up, but these are really, really the worst case presentations of psychological trauma that somebody may be going through. Somebody may feel guilty, okay, because you are the only one left alive. Maybe the rest of people have died, and then you continuously feel guilty. Why did you survive this or that event and all this? Emotional shock, they are in disbelief. Those ones can be immediate or over time. Irritability, somebody mentioned this, anger. You just, something small, this person can burst out at anyone in very unproportional manner that shows that they're really not happy about something, even if it is something that would not have attracted that level of reaction. Anxiety, panic attacks, these are all related to some of the things like the fear they have. So they tend to get, such things that they panic, and they are, you will be even surprised and be like, what is going on? But they are going through trauma in their minds. Okay. I hope with those, you will be able to help someone if you see some of those signs that they have. What are things that can put us into the danger of developing psychological trauma or stress-related disorders? Any of those things we have listed that can cause trauma can become a risk for these disorders, okay? So we just try to group them as environmental. For example, anything around us. In childhood, it could be neglect. When a child is neglected, they are not being provided for, whether it is their basic needs or the care, the love, and all these, they can grow up traumatized. Lower socioeconomic status, we all know this very well. Somebody mentioned about lack of money, things like that can really cause us disorders of the mind. War, I think South Sudanese will not want me to speak much about this because we have seen this a lot. Exposure, severity. So either somebody is exposed to the event directly or indirectly. For example, directly is a rape victim. Indirectly could be somebody who was standing by and a car accident happened that killed people, you know. I see war has appeared again here, murder, death of loved one, people in marriage who always will have issues, you know, when the issues continue and they become even bigger every time, they can easily tip them off to developing disorders of the mind. Sometimes genetic and physiological things. So physiological here refers to really the normal body function. Okay, sometimes inheriting a certain certain gene from certain families can make somebody more likely to developing psychological trauma or stress, and therefore getting the disorders. Okay, female sex tend to suffer a lot more trauma-related things than the male, and sometimes people who have history of such things, trauma and mental illness in the family, tend to have, others may also likely develop for one reason or the other. For others, things like negative appraisals, you know, not necessarily at the workplace, but you know, you've put on and everybody's just criticizing you left and right, whether at home or anywhere in the society. Nobody makes a good comment about you. Slowly over time, that can build up into a psychological trauma. Inappropriate coping strategies. So if I have lost a loved one and then how I am dealing with that loss is not really appropriate or is not helpful. I can give an example that if I have lost a loved one and then instead of me putting myself together and finding something better to do, I instead decide to take on alcohol, excessively consuming alcohol, assuming that I am dealing with this loss. You know, that can be an inappropriate strategy to deal or to cope with the loss. It can over time lead to a disorder. Of course, that is actually the next point, substance abuse. Alcohol is the first, especially in South Sudan, but in other countries, there are also other things, substances like opium and what? I think marijuana, I don't know, are they the same thing? Others even use drugs that are made from the factory to overdose themselves, you know. So all those are considered substances, and when they are abused, they can increase the chances of developing psychological disorders. Physical harm, especially when it becomes continuous, you know, repeated physical harm, somebody can always develop psychological trauma as such. All right. Having said all those, the symptoms, the signs, the risk factors, what things actually contribute to that. Let's look at a few of the many disorders that psychological trauma can cause. I've listed about 7 of them. The other 4, yes, they have notes in the slides that you can read through. I will not spend much time on them here, but I will just highlight what is in them. The other 3 highlighted in red, we will cover them a little bit in depth here. So reactive attachment disorder mostly is a childhood thing, okay? A child is growing up and maybe when they reach 2 years, you know, that is still an age the child is more attached to someone, maybe the mother, for example, and then whatever happens, they are separated from each other. This child, if they are already not well taken care of, they can actually develop this kind of disorder, which is a reaction to that attachment he or she has had with the person they have been mostly attached to. So they can develop that kind of disorder, and over time, as they grow, sometimes they outgrow it. Others can actually proceed to becoming serious mental illnesses, okay? On the other hand, this inhibited social engagement disorder is also another childhood mental disorder that in this case, the child is more of the opposite of the first. The child does not have any specific attachment to someone, maybe because they grew up with nobody paying closer attention to them. For example, babies who grow up in babies' homes, where there are few caregivers compared to the babies, such babies can have no social attachment that is so strong, and therefore they can engage with anyone, including strangers, so such children can actually be at risk of, for example, kidnapping, right? So if they grow up with that, that can also be a bad thing. So those of us who either are parents or intend to be parents, we should take note of such and try to raise up children in very good environments. Adjustment disorder, on the other hand, so most of these other 5 are more of adult disorders. Adjustment disorder is close to the reactive attachment in childhood. So like I have maybe lost my job. Let me use another example. I have been fired unexpectedly, knowing very well that I may have been doing well. So how I adjust to that new situation, if I don't handle it well, I might develop an adjustment disorder. You will read more in the slides when they are shared later. They are covered, but I just try to highlight. So adjustment disorder here is the event has happened, somebody is failing to adjust to live normally after the event because the event happened, you know. Acute stress disorder is very close and related to the next thing that we will actually look at here in more detail, to post-traumatic stress disorder. Acute stress disorder is just, so anything acute is of a short period of time, maybe a month. Here we are talking about maybe a month to 3 months. Somebody is unable to deal with the situation and they have developed mental disorder. In this case, after that period of 1 to 3 months, most times, most people overcome it and they actually no longer have the disorder. But where it persists to 6 months and even more, that is where now somebody develops what is called post-traumatic stress disorder. And therefore, let us see that in the next slide. And we will also look at depression, which is actually medically termed major depressive disorder, because there are other depressive disorders that are not part of these slides. I just said I highlighted big ones. And then self-harm. All these are really either forms of disorders, mental disorders, or a result of psychological trauma that people go through. Right. So post-traumatic stress disorder is the development of characteristic symptoms following exposure to one or more traumatic events. Examples like war, physical assault, sexual violence, being kidnapped, taken hostage, terrorist attack, torture, being put in jail, disasters, even severe motor vehicle accidents. All these are things that when someone experiences, they can become traumatic, and then they can develop characteristic symptoms that we term post-traumatic stress disorder. Post-traumatic, of course, simply means after trauma or after a traumatic event, and it is stressful for those people, right? So the event can be re-experienced in various ways. A common re-experiencing symptom is distressing dreams, nightmares. You go to sleep before you have really slept enough, and then you're waken up by, you know, you are awoken by stress. I mean, distressing dreams, bad dreams that tend to remind you of that event. You know, that is one common experience these people go through, that they replay the event itself, or that are representative or thematically related to the major threats involved in the traumatic event. Okay, let's talk of, for example, a kidnapping. There's always a lot of threatening in people who are trying to kidnap someone, whether a child or an adult, you know. So even if you are later on taken out of that situation and you're back home, one can still experience those distressing dreams trying to remind you of those threats that you went through. Okay, symptoms are usually come in within the first 3 months of the event itself, and they can go on. And the episodes tend to be, are referred to as flashbacks. So you are like recalling, okay, flashing back to the previous event, recalling. Okay, these are typically brief, but can be associated with the prolonged distress as well, including an increased level of awareness, so heightened arousal. You are so aroused, you are so alert, so aware that anytime really things are happening, you have very short moment you remember something, it flashes in your mind, okay? Half of the adult patients recover in 3 months, but others tend to continue for even a year or more. So that is what we say is now post-traumatic stress disorder. Again, there could be much more you may know about that. Depression, on the other hand, is a period of at least 2 weeks, during which there is either, so two things happen. Either somebody has lowered mood, okay? Somebody earlier in the discussion mentioned mood swings. Mood swings simply means at one moment your mood is high, you feel good, everybody appreciates around you, and then another moment the mood is down. So in major depressive disorder or depression, let's simply call it depression, somebody experiences 2 weeks, at least 2 weeks of either reduced mood, or a loss of interest, or pressure. They get a loss of interest or pleasure in what they really have been liking to do, or they may actually be also irritable, okay, and sad at the same time sometimes. So 2 weeks, at least 2 weeks period of experiencing such mood swings could be depression. But again, from my disclaimer, as I said, do not try to use these discussions or session here as definitive way to diagnose depression. There can be much more to depression than this, okay? But individuals who are depressed, they must also experience other things, other symptoms, okay? Such as changes in appetite or eating habits. For some people who are depressed, they don't eat much. Actually, they lose interest in food, or they don't have appetite. For others, they actually have a lot of appetite and they eat more than they used to. So it is just in between. They can also have sleep disorders, okay? Psychomotor activity, decreased energy, feelings of worthlessness or guilt, difficulty thinking, concentrating or making decisions, or they can actually have recurrent thoughts of death, including thinking of suicide. What we say is suicidal ideation. Okay, so they can be planning even to kill themselves. These are some additional symptoms that go with the depression, okay? Individuals may also report less interest in hobbies, okay? Example that I gave was watching football, and then somebody no longer wants to go for it, okay? They even don't care anymore whether it is well with them or not, whether they reach tomorrow or not, they don't care. Or not feeling any enjoyment in activities at all. These are other possible signs that somebody might be going through depression. Sleep disturbances, I talked about this. Either they have difficulty sleeping, or for some of them, they actually instead sleep excessively, so it's just in between. Decreased energy levels, tiredness, fatigue without any physical activity are also common in people who are depressed, okay? But again, let us use this to try to understand somebody's changes in behavior and so on, and maybe try to help them rather than use this to say, okay, so I've seen somebody with a depression and this and that. No, it should be a medical personnel to really diagnose this. However, having said that, there is this sheet that has been developed by psychologists or psychiatrists to help people in their own house to try to assess themselves for the possibility of having depression, okay? So there are these questions 1 to 9 that they should ask themselves, considering the last 2 weeks period. How often have they experienced any of these things that bothered them? And then they will put score, or they will check, how many number of days in the last 2 weeks. So today is Sunday, you can think back 2 weeks, and then you try to ask yourself, in these 2 weeks that passed, have I experienced little interest or pleasure in doing things, such as watching football or whatever interests me? Have I lost interest? Or have I reduced in interest or pleasure for doing this? Okay, if I have, how many days in the last 2 weeks? If I have not at all, I will check 0. But if I have maybe once, like 1 day, you check 1 day. If I've had more than half the days, that means 1 week and above, okay? We are talking about 2 weeks period. So half the days means a week and above. If I've experienced this for at least 1 week, I will check 2. If I've experienced this almost every day in the last 2 weeks, then I'll have to check 3. And then I go through to the next thing that I may have also felt. For example, have I had trouble concentrating on things such as reading the newspaper or watching television? Many of you do have their channels, TV channels that they like to watch. Okay, I also have some. So if you are such a person, in the last 2 weeks, have you had trouble really wanting to turn into that channel and watch your favorite program? Or if you are someone who reads newspapers, have you lost that concentration or interest in the last 2 weeks? If yes, how many days? And then you check. So at the end of it all, I will not go through each of them, but when you check, you add the total. Assuming that everything was scored 3, 3, 3. Since there are 9 questions, the most one can achieve is 27, a score of 27. But of course, you may not score everything 3. So whatever score you have given, you add them up and then you get the total score. We will see in the next slide how to interpret the total score. But before we see that interpretation of the total score, if you checked any of these 9 things, how difficult have these problems made it for you to do your work? Now we are looking at your functionality. How have you been affected by these things that you said you faced in the last 2 weeks? Have they made you unable to, for example, even prepare food? Have they made you not even think of going to the bathroom to shower? I mean, how have these things affected your function, daily function? So if they have not really affected you, not difficult at all, that's a good thing. Somewhat, if they have made your daily functioning very difficult or extremely difficult, these are areas of high likelihood of what? Having depression. So let's see what the scores say. So if your total score was 0 to 4, 0 meaning none of these actually you experience. Not at all. You have not experienced any of these in the last 2 weeks. So your total score can be 0, right? So if it is 0 to 4, the severity of any depression is almost not there or maybe minimal, okay? So this kind of a person or patient may not need any treatment for depression, okay? But if the score was between 5 and 9, this means somebody has mild depression and they need to use clinical judgment about treatment. So this is now the medical person who use their clinical judgment of the person in front of them to decide whether they can be treated for depression or not. If it is 10 to 14, they have moderate depression already. Again, the person should use clinical judgment. Clinical judgment here means how you appear before me in the clinic, how I interact with you, how you respond to me. So I do a general analysis of really how deep a problem are you in regarding depression. And then I decide whether I should really prescribe for you or not, okay? Anything from 15 to 27, from moderately severe or really severe, these ones will need what we call antidepressant drugs to reduce the depression, okay? But look here, any score that has 10 or more, okay? So from 10 to 27, there are about 88% chances that such people have depression, okay? And so somebody can really prescribe for such people over here. So that is about depression. Now, deliberate self-harm, suicide. Maybe before I go there, let me check in the chat box. I see 7 chats. Share attendance. I'm not able to see the slides. Oh, Christopher Lemmy, are you able to see now? Sorry, I'm not sure why, but I think others are seeing. Hope you will share to us all the slides. That has already been answered. Phone battery is badly low. Oh my God, sorry. Very interesting explanation. Right, thanks. Okay, so having said that, we've talked about post-traumatic stress disorder, PTSD. We've talked about depression. The third I would want to cover in this discussion is suicide. And yesterday I was on Facebook trying to just scroll through my timeline and see what could be up. And then I came across this from one of my, I think, Facebook friends, an announcement, and I really felt sad. You know, the last funeral rite of a 15-year-old girl who committed suicide on 8th July 22, after the brother confiscated her smartphone bought by the boyfriend, was held today, 23rd July 22, at Sukongolese, Juba. Pray and overcome the spirit of death. You know, and then yesterday, thinking of today's discussion about suicide, I really felt bad, and I decided to screenshot this this post so that I would share with you like this. Just an example of how big suicide problem is in South Sudan and maybe even in other places now. A lot of stress, a lot of trauma that people are going through. If you read this and the reason for suicide, you shouldn't think that this 15-year-old girl should really commit suicide. It is very difficult to imagine that the only reason was this, right? It is very difficult to imagine. So, but then it has happened, and they held their last funeral prayer yesterday. We can all wish her soul to rest in peace. So looking at this, a lot of things can always lead to suicide, right? Depression is one of them, despair, death, somebody's unhappy, desperate, no hope, things like that. And of course, for suicide really to happen, as we shall see in the next slides, there has to be something somebody facilitates it with, takes their life with. Okay, so yeah, so that's the magnitude of suicide. Let's go. So what is deliberate self-harm or suicide? It is simply the intentional taking of one's own life, full stop. Somebody intends to kill themselves, okay? A lot of views have been projected on suicide. Some of them think that it is an offense towards God. For those who are Christians, and I think even other religions really also believe that killing is not a good thing, and God does not want anyone to kill even themselves, okay? So that is one view people have projected about suicide. Others think that atoning for mistakes or failure, you know, they think it is more of a form of protest, you know. I don't know if the case of this 15-year-old that I shared above was an example of that person trying to atone for her mistakes. I don't know. I'll leave it at that. But yes, a lot of views have been projected about suicide, including such. Others say it is an expression of despair. Somebody just wishes to escape the world, you know, whatever situation they are going in or going through. Or, yeah, so just to escape rather than the genuine intention to die. It's very hard for a normal person really who is not going through a lot of trauma to feel like they should die, you know. Even the oldest of people around, they rarely will say, now God, it is time for me to go, right? They will always want to live and live on. So it's either somebody is expressing their despair of the situation they are going through, or they want to simply escape, okay? Other people, other views say it is a cry for help or attention, okay? It is, of course, associated with psychological factors, as we have seen. Mental health concern is one big thing. Mood disorders, substance abuse, especially alcohol and the other substances. You know, when someone is drunk, even the fear of death almost runs away, and they feel, you know, they can even do anything, right? So these are some things, some ideas and views that have been shared by people regarding suicide. Others also think that it is a crime, by the way, to kill yourself. I've heard, or you may have also heard of stories of corpses of people who commit suicide being put in jail for killing themselves. And another way you can think of it as a crime is, especially if it is assisted suicide, you know, somebody supporting the other to kill themselves, that person can be arrested and actually be put in jail as a criminal. So most people who attempt suicide do not complete it on the first attempt. So what do you think about this statement? Time will come for us to reflect on what I've talked through, but I think that this bullet is very important, and we should really be able to make use of this, that most people who attempt do not complete the suicide on the first attempt. That means they do not really succeed to die, to kill themselves. So as all of us in this call should be able to take this seriously and be part of the change, so that if anyone we know or live with has really attempted suicide once, but they thankfully did not achieve it, we should do something about that. Others even say that suicide is personal right to die. Okay, yeah, we all have right to live, right to life. But some people also say we also have right to die. If I choose to die, let me die. I'll leave that debate to whatever opinion each of us has. There are certain terms that we use to understand suicide. Parasuicide is really somebody not considering to really kill themselves. You know, they don't consider to kill themselves. They could be doing something that they never thought would really result in their death, and then they end up dying. You know, it's more of what they say is a behavioral analog of suicide without considering psychological orientation towards death. They are not intending to kill themselves, but then what they have done has ended killing themselves. You know, you may have heard of soldiers who may have carried a cocked gun carelessly, and then, you know, the nozzle turned on them, and by mistake they clicked on the trigger and they have shot themselves dead. You know, these are people who never really intended to kill themselves, but they end up dying. So that's termed that. Attempted suicide, on the other hand, okay, is an act of self-injury consciously aimed at attempts to kill themselves, but it acknowledges the gravity of the situation. But now these are the people who have not succeeded to kill themselves. We term that attempted suicide. On the other hand, when it is completed, this has resulted in a fatality, in death. Okay, so is a fatal self-harm or injury that has resulted in death. Murder, suicide, sometimes some people commit suicide as a form of committing murder at the same time. Okay, like you've heard of suicide bombers, people who wear bombs on themselves, and then they go to places where people congregate and they blow up themselves. The intention is really to go and kill other people, but again, they are killing themselves at the same time. So that is called murder suicide. It may be because they want to simply kill, or they want to escape punishment, okay? Or they are self-punishing them. I mean, they are punishing themselves. Like you have also heard of people who get the gun and kill everybody around, and then they kill themselves. So they are punishing themselves by also killing themselves. Others know that their situation is not okay, so to avoid their children becoming orphans, they would rather also kill their children, and then they kill themselves on top. Those are all dynamics of suicide that exist in our society. Okay, joint suicide is people agreeing that I think is enough, let us all kill ourselves. Suicide pact. Okay. So murder suicide is basically committing suicide in a method that kills others. For example, for planes, the pilot can decide to commit suicide, and everybody on board will all die. You know, if you are someone who likes watching TV, there's a channel called National Geographic, one of my favorites, and they have a program that investigates causes of air crashes. One of them that I watched was exactly suicide. You know, the pilot was depressed and had concluded on his life, but he couldn't do it alone. Everybody died. So sad. Okay. So what are the things that, or factors that lead to people committing suicide? Risk factors are basically things that increase somebody's chances of getting either the disease, or in this case, committing suicide. And it has been nicely given a mnemonic, that sad persons. So when you write this in full, you are able to know what could be the risk factors. And any one of us here should be thinking about which risk factor do I have among these that can make me kill myself one day, right? So one risk factor is the female sex. As we will see later, or rather, as I already said, I think earlier, females tend to really commit more suicide than males, okay? Females tend to commit more suicide than males. Maybe because of coping strategies that they use may not be very helpful enough, or they just tend to experience more trauma and stress than males, probably. Okay, but that is what statistics say, that females commit more suicide than males. In terms of age, This age bracket of all of us in this call really are the most common people who kill themselves for whatever reason, up to around 39, 40 there. Yes, such people tend to, I don't know, fail to overcome life challenges and they just take their lives. Of course, at 60 and above, some of these people, either they are depressed, they are lonely, and other reasons come in, and it's also a common thing around that age bracket. Depression, as I already discussed, is another risk factor. Prior history, so somebody who comes from a family where some other person had once committed suicide, they are more likely to actually also commit suicide, for one reason or the other. Ethanol, this is alcohol abuse. So excessive use of alcohol, as we already said, is one common cause or risk factor for suicide. Rational thinking loss. So instead of thinking or looking at a situation in a rational way and looking for how to overcome things in a nicer way, somebody's thinking capacity may have ended and they are like, oh no, here, there's no way. They kill themselves. Some of us, or some of the people who kill themselves, actually have lost their breadwinners and or any form of support system they have been getting from that person who has died, and so they find nothing helpful again in life. It could be an organized plan, like what I discussed earlier in the last slide, suicide pact or murder suicide, or somebody without a spouse, no significant other. So life for such people tends to look worthless, and these are mostly the elderly group, 60 and above. Sickness, especially chronic sicknesses. People tend to give up on life and say, instead of this suffering, let me go, So these are some, there could be other risk factors, but these are some of them that have been identified. Where does suicide happen mostly? A certain study in that place called Auckland found that 58% of the time, suicide happens actually at home. And I think we should also think around this a bit. If most of the suicide happens at home, what is wrong at home that prompts people to commit suicide? Or what facilitates suicide at home is something we might also think about and try to see if we can be helpful. Apart from that, others happen 25% in the public places, private residence 11%, and then sometimes in the hospital about 6% of the suicides. This is a study that brought up that finding. We don't have such statistics in South Sudan, but I just brought this for us to have an idea where most of the suicides happen. Look at the method of suicide for men and women, the same study. So green is men. I don't know if this is yellow or gold color, is women. Okay, hanging. And that's why I put this picture of a rope here. It's the most common way people kill themselves. And of course, where we live, all of us might be having ropes in the house, right? For whatever important reasons, we have them in the house. But as we have seen, most suicides happen at home, and the most common way is hanging. We should also begin to think around there, what we can do. Other ways include carbon monoxide poisoning. So somebody just locks themselves up in a very smoky place, and they end up dying from the poisoning. Overdose, this can be of medications. Look at this method, overdose. Women are more than men in terms of overdose, okay? They tend to do more self-harm or suicide using overdose of drugs than men, okay? And then the others like drowning, jumping from high, maybe Amara or firearms. Look at firearms, big difference between men and women. Is it because men tend to have more access to firearms than women and so on? I don't know, right? And there could be other methods really of suicide. How does suicide impact us? It can affect any one of us, especially those of us who may have survived it or who lose our loved ones to suicide. Could be the spouse, parents, children, siblings, neighbors, everybody. As long as someone around has taken their life, people will always be affected. Of course, we talked about the chances of another one happening in the future. It's possible. This is also another impact. Economically, of course, losing someone is not a good thing, especially the age bracket we talked about, 40 years and below. These are people of very high economic potential. We shouldn't be losing them. The legal implications, Yes, sir.
Yes, I just have some small concerns. Sorry for interrupting.
Yes, go ahead.
In regards to the statistics that you shared, and also the previous one that you shared about statistics showing that more women commit suicide than men. I don't know whether there are statistics of specifically South Sudan, because in the rumors that I've been hearing all this while, I think in South Sudan, more men commit suicide than women.
Possible. It's possible. Like I said, these are not statistics
if
from
really
South Sudan.
statistics are there, you can really help us in that. Thank you.
Well, I couldn't land my hand on any statistics on South Sudan regarding suicide. I don't know which government agency or even private or NGO would be doing this kind of study. Maybe we'll have to look it out together, okay, and see what the picture is in South Sudan. But I just brought this up to highlight. And as you see, actually, this is a very old study that was from somewhere there. But I still think that it is very close to the current situation of suicide around. But yeah, thank you for that concern. I think all of us together here will have to try to find out in South Sudan how is the situation. But that will need someone to have done a study on it. I'm not aware of any so far. Okay, good. So legal implications, of course, are always there. When it comes to maybe the person who has assisted a suicide, or sometimes people who actually kill themselves leave behind a note and say, I have killed myself because of ABCD. And if the ABCD is mentioning maybe like Jew did for me ABCD, that can become a legal implication again to me who is alive, okay? Right, let's look at how we can help people with the thinking of suicide. Especially in the health facility, every patient should really be asked about thinking about suicide, ideations, suicidal ideation. Have you ever thought about killing yourself? Research has shown that it does not at the end of the day make them suicidal, you know, but if they have ever thought, you know, it depends on the presentation, how they have come and what their complaints are. It might be helpful to really pick out these ideations early and then support them. Of course, assessing for cause of suicidal ideation or attempt, assess future risk of this person attempting suicide again, if this is someone who has actually attempted suicide now. So whatever they give you as the cause of their suicide will need to be treated as it is. So if somebody's reason or the cause of them trying to kill themselves is maybe loss of job, let me use that as an example, then every one of you who has come across that person should help this person really get another job, and you know they should settle their minds. Okay, so the best thing is treat the cause of that idea. That is when you can put things right. Otherwise, it may not help that they will have to go back to another attempt again. Most times, if someone has attempted suicide for the first 1 or 2 nights, they get admitted in the facility so that they are observed over there. And if that happens, this person should only be discharged when there is no longer any suicidal thinking or idea in their mind, and they are medically known to be stable. If they were committing suicide because of maybe drugs or substance, it should be seen that they are no longer intoxicated. Okay, and this person should also be able to promise that they will come back for help if the thoughts come again, the suicidal thoughts. But importantly, such people need continued psychosocial support, which can come from you, family, friends, psychologists, everyone around who can help should be able to continuously give these people psychosocial support. Stress management techniques, which will come up shortly in the next slides, also will be very helpful, because what we know is most people who end up committing suicide or attempting it have a lot of stress or trauma they are going through. And then, of course, keeping harmful objects away. If it is an attempt by firearm, for example, this person should be disarmed. If it is a rope, maybe those strong ropes in the house may need to be taken care of well. You know, keep everything that they can use. And those who try to do overdose, drugs should also be kept far from them. Engagement in economic activities definitely will give this person a reason for why they should live up to tomorrow. So if they can be involved in such things, or skills training and so on, might be very helpful. Regulation of and keeping, yeah, so all these things, items that they use for killing themselves, should be regulated. I mean, in South Sudan, it's very difficult to imagine how guns are everywhere. And yet, as someone said, a lot of times people commit suicide. And I think in South Sudan, if a study is done, probably the most common way people will have killed themselves is firearms. Okay, it might not be the rope as it was in another study. Okay. So another psychologist came up with this. These are really concepts. Promotion of well-being for entire population. Everybody should have well-being. And I think this makes sense because yesterday we started with the personal well-being. So if we promote our own well-being all over the country, the continent, and the world, okay, we reduce the chances of suicide. When that fails, then let us prevent the problems that tend to cause people to think of suicide. Those who are at risk of committing suicide, what are the problems they have? Can we prevent them? And if that fails, okay, early intervention should be given. And that's why you attended this session, so that you're able to tell whether somebody might be having ideas of committing suicide. And then, of course, if that early intervention is offered, the most important thing will be specialist services should be given. Psychiatrist or a psychologist should be really employed to handle such people with the ideas to kill themselves. I think let us first reflect. Who wants to share with us any experiences or thoughts about what we have covered so far? Before we go to the stress management bit of our presentation, any reflections? Yes, Moro, is that an old hand or new one? Go ahead.
No, I think it was an old hand.
Okay, Romeo. Romeo, go ahead. Maybe Romeo, before you go ahead, Bida, are you there, Bida? Is Bida online?
Yeah, I'm around.
Good. So just give me 2 minutes. Can you moderate people's reflections on this discussion so far? And then I'll get back. Continue.
Are you getting me? Yes. Okay, yes. Romeo, your hand was up, and then we come to Rejoice, and then Lemmy.
Yeah, so thanks a lot, actually, Ju, for a couple of the inputs that you put concerning more especially this topic of suicide. So I just want to share like a personal experience and reflection towards this. I lost a very close member of my family because of suicide. And it looked like a joke always. I mean, they always say, hey, one day I'll kill myself. One day I'll kill myself. And everybody's like, no, you won't do that. So I feel like maybe like how Leju has really spoken, it is something that is very key to note. Sometimes even from people's very simple statements. Suicide is not a very simple thing. I think it's nothing to be joked around with. And there are people who just speak it like that and it looks like a joke, but at times it becomes an option. When it becomes an option, it has a lot of power that sometimes just takes over someone in a way we don't know. And one day we just woke up from the house, 5 a.m. and found someone on a tree. So there's a couple of me, I believe, I don't know, but suicide is getting so rampant. Like when you come in the refugee camps in Uganda, people are going through a lot. And there's a lot of suicide cases that happen of late, more especially after food being cut off, and people just think that that's like the only option to take your life out, and which is hard, honestly. So I just thank Leju a lot for, a couple of those inputs, and more especially talking about the statistics in suicide cases and stuff. Yeah, thank you. That's just all I wanted to really put.
Okay, thank you, Romeo, for the input and also for the reflection there. sad about the experiences that are happening in the refugee camp. Yes, Rejoice. After Rejoice, then we go to Lemmy.
Yes, mine is just a question. Like for women who don't give birth, for barren women, how can I advise them on committing suicide? Me, I faced with so far 2 women who are barren. Okay, they tried treatment and everything, they could not, but all they could think about that they want to kill themselves. Okay, I tried to help, but I don't know how can I help?
Okay, your question is noted. Doctor will be able to respond to that. And Christopher?
Yes, thank you, Bida, and also thank you for the nice presentation.
Oh, looks like Lemmy has dropped. Yes, Pius?
I would like to reflect my point on, what might have, what if people might have heard, or like 2 months ago, what happened in Kajukeji, where 3 children of the same mother were murdered, and 2 months later, the mother decided to take off her life using these extra drugs. Don't you think it's a failure from the 4 level who are to intervene in that?
Okay, your reflection is noted. And Lukadi, and then again Christopher, and then we hand it over to Leju. Lukadi, you're welcome.
Yeah, thank you. I have a reflection on one area. And then I also have a question at the same time. You know, in South Sudan, we are really handling situations that are really very tough. And then when the facilitator was facilitating, he talked of shocking news. I don't know how can we really prepare best to receive shocking news. This is just the question.
Okay. How can we best prepare to receive shocking news? And yes, Lemmy, are you around?
Yes, I'm around. Sorry, I have a poor network connection.
Sorry about that. You're welcome.
I just wanted to put out, as they just said, and we need really to look out at the signs of suicidal thoughts. We need to look out for somebody who is having withdrawal or isolation from the colleagues. We need to see also about changes in the mood, and we need to see if somebody who is not usually drinking or drinking or taking drugs, we need to see those people and we can help them out as early before anything happens. I think it's only my few remarks on this, and thanks back to Leju and you, Bida.
Thank you so much, Christopher. Leju, over to you. There are 2 questions. One on the one of how you can counsel like barren women who have suicidal thoughts, and another one is like giving a case study of what happened in KG recently.
Yeah, thanks Bida for leading this reflection moments. And then I also thank everybody who reflected on what we have covered so far, whether by giving a comment or asking a question. I actually captured 3 questions, Bida. One is the lady who is unable to give birth. How could one help? I wonder if that lady succeeded to commit suicide or is still alive but has the ideas to kill them herself. Not giving birth is definitely something traumatic in our setting as Africans, and maybe as South Sudanese to be specific. There's a lot of expectation from society that someone should have children. If it was in the other Western world, I don't think somebody would be thinking of killing themselves because they are not able to have a child. But that lady, I don't know the medical assessment done. There are many assessments that need to be done to such a person. And then if For example, it is noted that maybe her problem is hormone levels or things like that. And if there is money that can facilitate artificial ways of fertilizing egg and then putting in there and all this, this could be other ways, but I know they're very expensive. Many people can afford. But if all investigations have been done and the conclusion is there is no way this lady can have a child, I think the best help this lady needs comes from her own husband to accept that the person he has married is this way by nature, okay? And therefore, he should just live with her peacefully and continue to live life without listening to what the society says. Beyond that, also family members have to really excuse her and stop, bothering her mind with all these things about the state that she's in as a woman. Otherwise, beyond these things that I've just suggested, it may not be very easy to really clear that in her mind. She may be somebody otherwise successful, maybe having a job or really having successful business, and she feels she can take care of children that she doesn't have. If it is nature that has decided so, I think anybody, human, should not really bother her on such a thing. I don't know how best to also counsel or advise in this case, but I think that's what I would say. The husband is the primary supporter of that woman, and he should be able to stand with her no matter what. Failure of all people to help in KK, in Kajokeji, and therefore, yeah, like I said, we all have a responsibility, definitely. And it is even sadder or worse that this mom who recently ended up killing herself because of poisoning, I later on learned that she had an attempt that failed. And that's what I said in the previous slides, that when we hear that somebody has really attempted, we should all be concerned as neighbors, as immediate family, as friends, as medical people, psychological or psychologists, everybody who has heard that so-and-so has once attempted to kill themselves but did not succeed. We all need to be responsible. Of course, in the case of that lady, the woman in Kajokeji, a lot of worries, a lot of feeling worthless because losing 2 children to a gruesome murder and then no justice being delivered and probably no sign of seeing justice coming in could have overwhelmed her, and she decided for that. But yes, government has to come in, and we can also point a finger at them, the government, for not doing anything at all levels, and also really people around who should have maybe done more. But we cannot say nothing was done, because I really don't know if there was nothing. Maybe some people tried, but still she had her way out. How to receive shocking news? It's not really easy for me to answer this, because shocking news that is expected, okay, may not be as shocking as news that comes unexpectedly. For example, if I have a sick relative, and we know that the sickness is definitely going to lead to death, such as in a cancer situation, because this will, the actual time that this relative dies will shock us because of human nature. We don't want to lose people as humans. But in this situation, somebody's mind can be prepared over time to receive that news without having so much impact on the mind as compared to a death in an accident, for example. That, oh, I woke up well, I was going to custom market, and then somebody knocked me dead. That kind of. Sorry, I dropped a bit. Let me reshare my screen. Sorry. Yeah, but I was saying that it is very difficult to say somebody should prepare to receive shocking news. If it is something that was expected over time, somebody, especially a medic, can take time to prepare somebody's mind to receive that news. But if it is not something expected, it is not going to be easy to prepare someone to receive. If it is the situation of a sick person with a terminal illness, it's the responsibility of the health worker to prepare the minds of the immediate family to know that their relative is not going to make it. It is the responsibility of the health worker. And of course, sometimes psychosocial support is needed here and there. But I don't think I have any prescription now that to receive shocking news, this is the way someone should do it, okay? Right, I think let's proceed so that we don't take much of our time. Oh, before we start stress management, I came across this again from Facebook, and I really was amazed. 44% of dog owners would rather turn to their dog for emotional support than talk about their feelings with their family member, according to a 2019 study. Ladies and gentlemen, in this call, if this does not really shock you, I don't know what could. And we are just talking about family support being important, especially for people who go through trauma and stress. You know, it is unfortunate that this big number of people think the dog is a better friend than anyone in the family. You know, I just threw it there for us to reflect on. Okay, so now let's look at the last part of the presentation. How do we manage stress? Stress management, as you may have been told somewhere, somehow, you know, especially as medical people, we like telling people, you know what, avoid stress, you know, reduce stress. But we often don't go into the detail of what should that patient do so that they don't have stress. And we have looked at so many causes of trauma and stress. If that person's stress comes from maybe an abusive partner, how will they avoid it? If the stress comes from lack of money, am I going to give that person money enough to take care or to take away their stress? Maybe not. But yeah, we have things that we can suggest to people that when the stress sets in and they realize that they are now feeling stressed, these are some things they should do or say and so on. So in this presentation, I'll take you through about 8 different forms of exercises. There are 10 here, the other 4, according to the text, they need somebody, you know, trained or a specialist and so on. But the others, somebody can do them even after this session, you can be able to practice them. When you begin to feel stressed, whatever the reason, you can take on any of these exercises, and over a few minutes, 10 to 20 minutes and so on, you might begin to feel a little bit of relief. And then after these exercises, we will also talk about other ways we can recommend people to deal with their stress. What is important is that you should know that the mind is easily fooled, if I can say. You know, you can, one thing I should actually give you as an example is, if somebody beats you, maybe let's say in the butt, you know, you may have been beaten when you were young in school, and you go massaging the butt quickly, like you are crying or what, but you are just massaging that place. In a few minutes, the pain disappears. You know, it's all in the mind. The pain was, the beating gave the mind a sensation of a painful event around that part of the body. But then when you massage that part of the body for some few seconds or a minute, then the brain now, the way it works, begins to pick the massage and forgets the pain, you know? So it's like you're fooling the brain that forget about the painful beating, but I'm massaging this area now. Please let you sense the massage more than the pain from the cane, right? So that kind of, you know, switching the focus of the mind from one thing to another is really helpful in terms of dealing with the stress. And so anything that is causing you mental stress and bothering you, if you just twist the reasoning in your mind to another thing, you know, that sensation will disappear, at least for some time before it comes back. And so these are some of the things we will be going through. I will try my best to explain whatever big terms that may make you not understand, but I will go through these other 8 that are in blue. Of course, these ones in black that I said, some of them need trainers, specialized trainers. They are also there in the slides, the notes, you can read what is done and so on. So let's look through them. In PMR, or progressive muscle relaxation, this is a technique for reducing stress and anxiety by alternately tensing. So to tense something is like to put it together like under a certain pressure, okay? So you compress something, make it tense. For like 10 seconds, and then relaxing it, letting it loose, okay, for like 20 seconds. So here we are talking about muscle groups. Maybe the leg muscles, maybe your abdomen, your chest, your arms, maybe even face. You can do them in a certain order that you choose. So at one moment, let's say you fold your hand, you are making the muscles tense for like 10 seconds, and then you leave them relaxed for another, let's say 20 seconds. So you can do that for the arms, for the abdomen, for the legs, any part of your body that you can move the muscles, you can do that. So individual will focus on the distinction. So what you're focusing on is, what is the difference in feeling when I fold my arm and the muscle groups here are tense? These muscles are tense. What is the feeling I get? You are focusing on that feeling. And then when I open out my arm or I relax it, how about the feeling I get? Okay, so you are focusing, you're making your mind focus on this feeling in your arm muscles instead of the pain or pain perception that is giving you the stress. So in this case, this will create a pleasant mental state. Like, you know, you're focusing on this and that, and then the mind begins to get pleased that there's some better feeling here than the other one that was stressful. So this will ultimately reduce anxiety in response to the stress that is on you. Okay, so progressive. So you begin from one side of the body, maybe the arms, then you go to the legs, you go to the abdomen, there are muscles of the abdomen, even the chest, you know, just focus on those exercises. And then what was stressing you, the anxiety you had, will disappear. Okay. With the practice, the patient learns how to effectively relax in a short period of time. If you practice this, so this is called PMR, progressive muscle relaxation. It helps the brain, the mind to focus on something that you want it to focus on, and then allows it to forget whatever was stressing it. The other method or exercise is called AT, Autogenic Training. Auto, if you can tell from English, like self, okay? Autogenic, like this is something that is generated by the self, by yourself. It's not something from elsewhere. So this is autogenic training. It's a self-relaxation procedure by which, okay, a psychophysiological determined relaxation response is elicited. Psycho refers to the mind, okay, the brain, the function. If you remember from science or biology, something called the nervous system, you know, psycho is to do with that. Physiological, as I earlier said, is to do with the body functioning. So a combination of how the mind and the body work at that moment determines a relaxation response so that the whole mind and body becomes relaxed. So it is a self-relaxation procedure. Okay? So individual will learn a set of directions or exercises that command the body to relax and control breathing, blood pressure, heartbeat, and body temperature. So what you need is you find a quiet place, you can lie flat, you know, and do this exercise, autogenic training. Okay, it consists of 6 standard exercises. With the use of visual, imagination, and verbal cues, you make your body feel warm, heavy, and relaxed. There are steps that are included in the slides here in the footnote. You can always read them through and understand better. I was thinking of sharing this as PDF, but I think maybe I'll share them as a PowerPoint so that you can also read the footnotes. So useful in a range of diverse disorders, including tension, headache, and all these. So things that stress, even sometimes in reducing high blood pressure, hypertension. Okay, this exercising is useful. So let's see, how do you do it? For example, you take a few slow breaths, quietly. You speak to yourself. So you're breathing in and out quietly. You know, we said you should find a quiet place, right? And then you speak to yourself, speak to your mind. I am completely calm. You know, you are breathing slowly and you assure yourself that you are completely calm. Okay, you can do that 2-3 times. Then you go to the next thing. Focus on your arms, for example. Again, you are switching your mind to really focus on something you wanted to focus on. Look at your arms, and then you will tell yourself quietly, again, you speak to yourself 6 times. My arms are very heavy. And then you add, I am completely calm. Okay, so switch your mind to the arms, look at them, tell your mind that the arms are heavy, they feel heavy, and then that you are completely calm, you know. So you do this, then from there you can go to the Again, it's still on the arms, you can now begin to say, from heavy, you say they are warm, and you are completely calm, okay? So from the arms, you can go to the legs. The legs are heavy, and you are completely calm. Oh, the legs are warm, you are completely calm. So you just keep going, focusing your mind on parts of your body. These are just some of the statements I put in the slide here for us to understand the autogenic training. You're trying to train your mind to appreciate something else so that its attention is taken away from the stress. Okay. You will read more in the footnote. Relaxation response is another exercise I thought of including here. This is a simple one. Okay. 10 to 20 minutes a day, you are done and you have achieved relaxation. Important characteristics here include repetition of a word, sound, prayer, thought, phrase, or muscular movement through which concentration is achieved. So you repeat it. Whether you choose a word, you repeat it. Or a song, you keep repeating it. Or a thought, you want to think about that thing you have chosen, you repeat it. And then in about 10 to 20 minutes, you really will feel relaxed. Passive return to the repetition when other thoughts intrude, you also should be able to, because sometimes when you are trying to focus on your arm, for example, in the previous exercises, sometimes some thoughts also intrude. Even the stressful thing that actually you are trying to relieve yourself of may also intrude, okay? But when that happens, take your mind back. Say, this is the word I'm focusing on. This is the sound focus on, okay? So you do that. So during please mute yourselves, okay? So during relaxation response, the body moves from a state of physiological arousal to a state of physiological relaxation. The body was, by the stress itself, already what? It was aroused. It was ready to do anything, either to fight back or to run away and so on. But when you now begin to focus your mind to something specific over time, it begins to relax, and then you get your body back to normal functioning. This kind of exercise helps with the lowering blood pressure, okay? It also improves heart functioning, and it can relieve even some medical symptoms. So again, just focus your mind to the word or the thought or the sound or prayer, concentrate on it, right? Now, diaphragmatic breathing is another exercise. If you remember your science or biology very well, you have the chest up and then the abdomen down. There's a muscle, a big muscle that separates the two compartments so that the chest is up and then the abdomen is down. That muscle is called the diaphragm, and it is the major muscle that helps us in breathing. So when it moves up, we are pushing out air. When it goes down, we are taking in air, that kind of movement. So we can use that muscle actually to cause us to relax, okay? So it is also sometimes called abdominal or belly or deep breathing. These are all other names for diaphragmatic breathing. It is marked by expansion of the abdomen rather than the chest when breathing. So when we breathe, normally you see the chest coming out. That is when you take air in, and then going back when we breathe out. But here we are trying to use the diaphragm so that it is the one that visibly moves, and then it will look like we are breathing by the abdomen. Okay? So here you are taught by a trained professional. This is not necessarily so. I think even after this discussion, you can do so. So it's a manipulation of the breath movement. Okay. At the end of the day, there would be decreased oxygen consumption, and then decreased heart rate and blood pressure, and then increased relaxation. How do we do this diaphragmatic breathing? Lie on your back or you are seated upright, okay? And then, so let's take the example of lying on one's back on a flat surface, maybe in bed. So with your knees bent, so you fold up your knees, and then your head is supported maybe by a pillow, okay? You can also put another pillow under the knees if you want. Then you place one hand on your upper chest and the other just below the rib cage. This will allow you to feel your diaphragm move as you breathe. So you breathe in slowly through your nose so that your stomach moves out. So the hand that is on the chest should actually remain still, but the one at the diaphragm level or below the rib cage should be the one moving up and down, okay? So the hand on the chest should remain still, and then the one on the abdomen rises when you breathe in and then goes down when you breathe out. You can tighten your stomach muscles so that your stomach moves in, causing your hand to lower as you breathe out. All right. So this is just the exercise, and you are focusing on it only. You are in a quiet place, lying down. Focus your mind on it, and then you can gain relaxation. Another exercise is called the Transcendental Meditation Tm. Simple and also easily learned, requiring to be practiced for about 20 minutes twice daily, while sitting with the eyes closed and repeating a mantra. So the best example here is actually the yoga. You know, those who do yoga. I don't know, yoga is more of Chinese, Indian thing, or the Asian countries there. They do a lot of yoga. In yoga, they just sit there and they are focused on something. Eyes are usually closed. They can be, you know, murmuring something in their mind or even in their mouth, talking about something that they are focusing on. And usually they get restoration of normal function of bodily systems also, including, you know, adapting to the environment and even any stressful challenges around the environment. Okay, so this is what in TM people do. Transcendental meditation, how you do it. This is seated upright. Okay, so comfortable chair, keep your back and neck straight, close your eyes. You know, begin with the 30 seconds of quiet. You are just quiet for 30 seconds first, and then you repeat the mantra in your mind, whatever mantra it is, a statement or a word or something, okay? Don't think about your breathing when you're doing this exercise. Just focus on the mantra, sit there quietly, and let your mantra draw your attention, okay? But allow the thoughts to float by. You may experience moments of transcendence, a pleasant feeling of restful alertness, okay? Meditate for about 20 minutes. So you can take three 3 minutes before opening your eyes. So after the 20 minutes, don't just immediately, okay, I'm done. Take some time, allow that more relaxation to come. As we said, you can do this twice a day. You will really feel a bit relaxed. So that is the transcendental. Another thing is cognitive behavioral therapy. This is really a very common form of managing psychological disorders that is always prescribed. And in this case, there has to be a lot of collaboration between the clinician and the patient who is being treated, because a lot has to come from the patient. Again, I said cognitive relates to higher brain functions like the thoughts, the thinking, the speech, the language and all this. So that patient is put through that kind of training or treatment that allows them to restructure the process of their learning or their reasoning or their thinking, so it takes some time, but it is helpful because at the end of the day, they can regain their, maybe, for example, if someone was confused about something, any distortion in the mind can be relieved because they are put through a series of steps over time to train them back to the normal behavior and the normal mental functioning. Okay. Mindfulness-based stress reduction. So these exercises link your thinking and its resulting impact on feeling. Okay. This one takes 8 weeks, employing mindfulness meditation in order to alleviate mental and physical suffering. Okay. Again, yoga exercise is one of such. Okay. So the technique assumes that greater awareness of the here and now will provide clearer and more accurate perception, reduce negative affect, and also improve energy and coping. That is the assumption in mindfulness. So you are trying to mind about here and now, not yesterday, not tomorrow. Okay. So skills are cultivated, emotional regulation is developed, and rumination and worry are significantly reduced in mindfulness stress reduction. So you're just focusing about here and now. Not even the next minute when I walk out of my house, what am I going to do? No, focus on here and now. Give yourself that time to think about. Right, emotional freedom technique, EFT. This one works by a person tapping on some body parts. You know, I will show you a picture and it's really quite interesting while speaking aloud, a specific meaningful short phrase, okay? So you identify an issue that is bothering you, create a statement that describes your issue, followed by a statement of self-acceptance. Again, in the footnotes, you will get more. For example, what is bothering someone is that they feel anxious about work tomorrow, because tomorrow is Monday. Somebody is already anxious, and where do I begin, you know? And so you create that situation and a statement to calm yourself down. You could say, even though I feel anxious about tomorrow, I deeply and completely accept myself. You know, that is one example. Or you could say, even though my partner broke up with me, I deeply and completely accept myself. You know, emotional freedom. That's just the meaning of it. You are speaking of that specific thing, adding on something meaningful that motivates you, that encourages your mind and makes you feel at ease with yourself, you know. Leads to reduced pain perception, increased acceptance, coping ability, and health-related quality of life. So you reassure your mind and yourself that whatever the situation I have, yes, I appreciate it is here, I have it, but I am really completely ready and I accept myself the way I am. Emotional freedom. So when you talk about those things, you are tapping on some parts of your body. And these are some of the suggested parts. Outer palm, you know, you're just quietly there. Although I'm anxious about going to work tomorrow, yeah, I am completely, and you know, what did they say? Completely and what? Yes, deeply and completely accept myself. You are tapping at that. When you finish, you go to the top of the head. You are repeating that mantra, okay, or that statement, whatever is bothering you, and then you attach a positive sense to it. Then you can come to inside the eyebrows there, just like that, and you are repeating the statement outside of the eye, somewhere below the eye, below the nose, below the lip, the lower lip, okay? Or even under the collarbone or the clavicle. So just touch those parts. You know, the sense here is that these parts of the body tend to have things that help the mind to reason. And when you tap on them, they actually stimulate the mind to focus on whatever you are doing. Okay, so these are what we call the emotional freedom technique. So allow your mind to believe that you are free of whatever emotion and you completely accept it. Having gone through those exercises and how to do them, just to wrap up the management of stress, other stress management strategies, as I said, of course, is addressing the cause of the stress. This is the most important. If there are basic needs that are needed, can someone really avail them? Somebody's stress will go away and all the disorders we have talked about will go away. These days, I see a very unfortunate trend of events where people are quick to open up a WhatsApp group after I have committed suicide or I've died of a stress-related thing. I mean, why? Create the WhatsApp group when I'm still alive, add me to it and mobilize the support I need so that I benefit from it. Anything else you do after I've died is basically for you who are alive to enjoy. There's nothing much, right? So let us try our best in our own different capacities to address the causes of stress, both for ourselves and people around us, so that none of us really succumbs to any of these things we have discussed. Seeking social company, support, or care. Of course, one such is meeting the doctor. You know, I'm not feeling so well. I think I'm stressed. I have this issue and all this. You know, please do not try to Google up things. I remember talking about this yesterday. Whenever you Google things, just because you think you need some support online, you are likely to get a lot of information actually that confuses, and yet information is not the same as knowledge. But when you meet someone physically, they will use knowledge, experience, and everything to guide and help. Counseling is helpful. If a counselor can be sourced, such people should always get counseling. Really, really helpful. indulge in job or work or training, any vocational activity that takes your attention away from whatever is stressing you. Identify recovery goals and build hope of reaching them. What are the recovery goals? I mean, why do I want to overcome this stress by not killing myself? Maybe, oh, okay, maybe I have a child in P1 and I want to see through her or his education, right? That is a recovery goal. You are building hope of seeing your child's education through. So that motivates you, that actually encourages you, and therefore you are likely to find better coping strategies than others. Reestablishing relationships, especially intimate relationships, as much as it is possible. People should be able to really get back to their relationships that have been helpful and remove the stress. Of course, monitoring of symptoms will be your and my responsibility for the sake of other people, even for myself, for yourself. If you can monitor that, I think these symptoms or signs are showing that I'm stressed, please monitor them and try to intervene before anything. And yesterday I talked about, in terms of occupational health, taking your leave from work. It is very healthy, very important. It will also reduce some stress at the workplace, especially. Do not say you can't, cut off the apostrophe and T and let it be, I can do it. This is a very motivational statement to anyone who is really stressed, especially when they have what they are talking about that they can do. And they will do, and we will reduce trauma and stress. Acknowledgements again. Wow, I think Bida, up to here, we might have not really gone too far away from our time, but that's where my presentation ends for today. I think let me invite, if there are any questions, comments, reflections, I will be very glad to listen to them. Thank you all for listening. Over.
Great. Thank you so much, Leju, for the presentation. So at this juncture, we would like to welcome any questions that you have, or if you're in an environment that is noisy, you can just put your comment in the chat box. And please do not forget to register your attendance. Use this time. I have put the attendance both in the WhatsApp group and also in the Zoom chat box. So please do register your attendance. We'll use the information to process your certificates for attending the 2 sessions. So you can raise your hand and ask any questions you have, or make any comments you may have. Otherwise, thank you all for attending this 2-day informative sessions. We hope that the 4 hours that you have dedicated have been a very good investment of your time. Yes, I see a hand up from Christopher Lemi. You're welcome.
Maybe, Bida, sorry, before the hands, people who have put up the hands come in, can I just respond to some question in the chat box?
Okay.
Davis is asking, is there a good stress and bad stress? I came across, right. So sorry, my computer needs charging. Bida, let me go ahead. Let me get the charger.
Okay, Lemi, you can proceed with your comment or question. Lemi, are you there? Oh, Lemi has dropped. Yeah, so in case you have any questions or you want to make any comments, you can put up your hand. In the meantime, do not forget to register your attendance. Yes, Daniel, you're welcome.
Thank you. Thank you so much, Vida. It has been a great joy actually going through these 2 sessions, and I've learned a lot. And my question is just simple. It is not about what we've learned, but it's about the issuing of the certificates you're talking about. I don't know if it's going to be electronic or it's going to be given or when it's going to be given. All that is what I need you to elaborate. Thank you.
Okay, the certificates will be electronic. We will send it as PDF to you, and then, or we will send it in a Google Drive folder, and you check for your name and download it.
Okay. Yeah, thanks, Bida, and
Yes,
Yeah,
Leju, you're back. Over to
yeah,
you.
I'm
Thank
back.
you so much. Got you.
Davis was asking,
I wanted to say something briefly here.
well, would you wait a bit? We'll give you a chance.
Yes. Yeah, okay. I was wanting to bring the other part where you talk about the lady who committed suicide because the brother confiscated the phone. So this is like, when we look at that part there, the girl was underage. That was 15 years old. She was still very young. So meaning she was still in adolescent stages. And there you have never brought a topic about young girls at such an age and boys who are in those kind of ages, especially in the terms of growth. You guys have never discussed about that topic.
Okay. Maybe I'll leave that to Bida to handle and decide. I am also not sure what exact topic you would want covered regarding adolescent people. But yeah, I think I'll leave it to Bida. Maybe he has an idea what can be done about such, if there's a need for a training on such. Okay. I appreciate everybody who has been texting in the chat box, appreciating the organization of these 2-day sessions. Sharing of slides, we already answered that several times. They will be shared electronically. Is there a good stress and bad stress? I came across someone on Facebook highlighting the benefits and harmful effects of stress, and that's where he mentioned good stress and a bad stress. But I didn't think much about it. Thanks. Okay. Like I think I said this yesterday, that the body, sometimes stress is a way the body can communicate to us. But this depends on what kind of stress we are talking about. The stress we have been discussing here is psychological stress. Bodily stress is communicated in different ways for us to understand and be able to know that this body is not feeling well. One of such stresses is, of course, tiredness, exhaustion. If I'm tired, my body will not want me to do anything and I have to find rest. That means the body is actually already stressed. Not the mind as such, but the body is stressed. Yesterday also I gave another example of maybe feeling thirsty. That is the body communicating that, you know what, I'm not happy with you. Please give me water. And then somebody thinks of taking water. So that is stress. Maybe that is the kind of good stress that somebody was trying to talk about. But every mental stress is unlikely to be a good stress, because as we saw in the discussion, it might progress on to become trauma, psychological trauma, and its dangers are many, as we have seen. So I think, Davis, that's what I will say about that. Or it could better be, you can ask the person who said those and to really help you understand better what they mean by good and bad stress. If you find yourself forgetting something you just read or not remembering information you just heard, how could someone manage such situations? You are the one asking this privately to me, but enhancing memory, enhancing remembrance has its own approaches. One common way is, of course, rehearsing. You rehearse what you want to remember. If it is a name and you think that the name is hard to call, you can try calling it 2-3 times until you get the right way to call it. That is rehearsing. And so forgetfulness is a normal thing. Everybody forgets, right? But also when it becomes too frequent and too much, so much that even simple things you cannot remember, then it might be a sign that something is also wrong. And they might need to be investigated further and managed as they are found out. Okay, that's what I can say. I'm really feeling this explanation on the emotional freedom techniques. Very good, thank you. I have a question in the chat box. Yes, I think Davis have answered that. Do children also experience stress and trauma? Of course they do. They do. And I remember when I started talking about the different disorders that come with the trauma and stress, the first two were actually childhood disorders. So children do experience stress and trauma. Many times, of course, they end up either crying because of inability to change their situation, And others can grow up really bad people as well. They can become wild. Thank you, everybody, appreciating the presentation. I'm looking for a question that I can respond to in the chat box. I'm not seeing it. Okay, I think let's leave it to.
I want to ask a question, but I don't know. My hand is already up.
Yeah, go ahead. I'm back to people's hands now.
Okay, thank you so much for presentation. So what I want to learn is about the issue of, you know, there are social norms, the culture that we have as per the context that we are in. So I think they are contributing mostly to the trauma, to the suicidal thought, to everything that is happening. So what could be the best approach that we can do to make sure that we help those who are happen to be victim and those who are almost to be the prime victim of this kind of thing that we are going through? And I think to a rough question, a rough comment, I think that is good kind of a stress, because when they said you have to make sure you go through bad thing to make sure you achieve something, because out of a worst situation, that's where maybe you'll be able to do something. And I think that is a good kind of a stress. Thank you so much.
Thank you, Gatmai. Moro, go ahead. Moro, Stephen, your hand is up. Unmute and go ahead. Yes.
Yes. Thank you so much for the opportunity. And I really appreciate the presentation. It was really so good. And now that we're almost coming to an end, I really expected more. I was once having that thought of really committing suicide, because when I was in primary, I had teachers who were really terrible in terms of caning, especially my maths teachers and English. I really never felt well. And of course, they were telling us these are Arab teachers who would cane you very well so that you'd understand. But to me, it was something else that was different. And I really had that. And I really, up to today, I don't even feel comfortable seeing figures of maths and even approaching issues to do it maths. I don't feel comfortable. I don't even have the interest of doing that, just because of remembering all those canes and all those things. And I just want some assistance on how do I deal with such kind of scenarios, or how do I manage such kind of situation? Because I have that fear that the next time I have children, if I don't handle it today, it might spill over. So probably me or some other person out there is also going through the same thing. You can easily help us on how do we handle such kind of childhood or spillovers of childhood traumas such as this, in order to handle them so that they don't go over to the next generation that we're going to also handle. Thank you so much.
Thank you, Moro. Unfortunate situation you went through. Sorry for that. And let me maybe begin with the other previous questions asked. Gadmai, I think he asked about stress related or caused by cultural practices. And I think in South Sudan, it's a lot of it. Some commonest example I think we can talk about is marriage. You know, people who intend to marry, really, when they involve or they get into the process of marrying, it has become so exorbitant, so costly to many people that it is becoming almost impossible to really marry. And these are cultures. I don't think I have a specific answer or prescription to all of us and say, let's do this. But it would be good for every community in this country to really sit down and look and analyze and understand why this sudden change of trends, especially when it comes to marriage and other cultural practices that are causing a lot of stress. It might be up to every community to think and sit and think and maybe agree on to changes that they want to make regarding this. You know, it should be possible. It is not easy for me to really address cultural induced stresses in a single one-fits-all kind of approach, you know, but I would say every community should rethink their cultural practices and be able to actually accept to live out whatever cultural practices that are contributing to stress. You know, that would be my response. In the chat box, somebody asked, what are the dangers or effects of trauma to one's health? I think this is the whole discussion we have had from 1 p.m. And maybe you joined in late, but we have looked at so many disorders that can come. I mean, psychological illnesses that can develop from trauma or stress. And that is one way they can affect our health. How to deal with the previous experience of being beaten at school, that is physical child abuse. Child abuse is in many forms. And actually child abuse, one common risk factor is a parent who has experienced child abuse. Moro, it is good you shared in this call with us, and I'm happy that you are concerned about your own children in the future. As a concerned upcoming parent, I think that you will do your best to ensure none of your children is abused. But it is known that people who have gone through child abuse are more likely to also abuse their own children or even other children. Now, how you can deal with it, I think, is accept the past and say that has gone. Now here you are. You will have children, you will raise them up well, and you will try not to abuse them in any way. I think that will be one way you can deal with that. The flashbacks keeping on coming, maybe use some of the information we shared here to deal with it. Whenever it comes in your mind, switch your mind somewhere and focus on something else that takes your attention. I think that will be really very helpful. I see someone had a hand up, but it has disappeared. Okay, if the question is answered, then that is okay. How do I overcome the stress of being unmarried? Oh my God. How do I help you in this? Being unmarried, is it because you cannot afford to marry, or you don't have someone to marry, or is it by choice? You know, like I said earlier, our society tends to demand a lot from us, even in our personal lives, including marriage. Marriage should be a personal thing that two people agree to enter into. And whatever they decide in their union should be really their own personal matter. But in this country, it is not the case, right? And there can be a lot of stress coming up. I want to say that you can think about it or overcome it just like any other stress you face. The many ways we have talked about dealing with the stress, you could try any of them. But the most important thing is you to understand, why are you not married? What is the problem? Can that problem be fixed and you get married? You know, like I said, it should be treating the actual cause of the stress. Okay, the presentation will support on that part of disorder because network interrupted me. Fine, thank you. I think Bida, up to here, there's nothing much from the chat box, and I don't see any other hand up. I'm glad that we have really kept it within almost 2.5 hours of our agreed 2 hours. I appreciate everybody who has joined this call, including those who joined even yesterday's. I thank you all.
I want to help that
participation.
who was talking about the issue of unmarried. I want to also try to give him some few tips on how we can also.
Welcome, go ahead.
Yeah, okay. Like before, I said that these are some of the factors that can result into stress, whereby like you shouldn't actually look at your colleagues as a major factor that causes you not having married. Look around what you have and see your situations and how you think you can overcome it and how you can make it. For example, if I was in good relationship and I have a friend and my friend is not having a good relationship, that one doesn't mean that I should also struggle to have the same lifestyle like my friend has. It is impossible. So I said before that you should be comfortable with what you set for yourself and go and give yourself that time and to look around what you think it really stresses you so much. So according to this guy, I don't know his name, I forgot, but he's having a stress of he doesn't have a partner. So what I can advise him is let him give himself time, and then for him to fall into a relationship, maybe his previous relationship was not so well, or he has been having several relationships that haven't worked out, or maybe he's now on the stage of growth because he now feels he's now contented and he's committed, he's able to handle a family. That is when now you start feeling stress. So if you haven't made that decision in your mind that you had wanted to be in the position of maybe getting married. If I am in a relationship and I say, I'm not ready to settle, but my partner is not yet ready, it can never work. So it should be a discussion which makes that both of them agree to come together, and then him himself, because most of the thing comes from the man, because the man is the one owning a lady. So when the man is now taking a decision of having a woman, he must have seen his capability of how he can manage to take care of the woman, because there are a lot of circumstances that can be arise during that time of marriage. He should know how to handle the issues, and he should know how he's going to take care of the wife. He should look about his income, his financial stability, all those things, and his capacity of how he can stand as a family. Because
Thank
in
you.
the start, it's not something that is very easy.
Thank you, Go.
And so I want to tell him that let him give himself time and make friendship first before going for a relationship, so that you don't get heartbroken. You have to first find a person who is your best friend, and then before you rush for a relationship. Some people go for a relationship not just because they want a relationship. I may break up today and then I wanted just because of stress, depression. I was idle. I need someone to give me company. You see that? So he should just give himself that time and space, maybe to quit relationship for some time. He will recover, and he should not always focus on that part. Let him just focus on what is very important in his life. Relationship will come. Thank you.
Go. Thank you so much. I believe that the person who asked the question is still online and has understood whatever you have said. I've also seen someone appreciating your feedback on that. Thanks so much. Bida, before we really hang up, I wanted to hear something from Grace Mwakalinga. Can you share with us anything you want to share regarding the presentation or the situation in your country? I'm just so interested that you were able to join this from yesterday and today. Anything, Grace? Okay, maybe she's not nearby.
Hello. I think.
Yeah, go ahead.
Hello.
Yeah.
Okay. I'm Grace Mwakalinga, a journalist from Tanzania and a student of Open University. I'm so thankful for that opportunity because I'm learning a lot of things consist of stress, depression, stress management, how to overcome trauma, and so on. So to my own side, I can say you are a doctor because I'm among a victim of that situation. I'm learning a lot, especially when a moment you have a stress about the relationship. Sometimes maybe I can decide to drink alcohol, the drugs, to go at nightclub, so as maybe to get a help or to stay fun. So according to that materials, you can share how to overcome stress peacefully, and you become safe. More rather than that situation, maybe I can go to disco to drink alcohol. You can cause another situation, which is cause a danger to your health and your mental. So I'm thankful, and please, this program, can you have to bring us every moment, so as to remind us.
Thank you, Grace. I appreciate your comments, and once again, thanks for being part of this. I think from my side, once again, thank you all for being part of these discussions. Bida, I hand it over to you. I think I can stop recording, right?
Yeah, you can stop recording.
Thank you.
Okay.